So good afternoon, everybody. My name is Kelly Ryan Brown, and I'm the founder and director of Recovery Partners. I've been doing this for 20 years at Recovery Partners, and prior to this, I did 13 years at Woolworths. And I kind of fell into this career. I was only thinking the other day, I started working on a checkout, as most of us did back then in the day. And I finished high school and did a Bachelor of Commerce and majored in Human Resource Management and Industrial Relations. And my career goal was to get a job in the personnel department in the Woolworths State Office. And one day they called me and said, would you be interested in a full-time position as the State Return to Work Coordinator? And I said, yes, absolutely. And I immediately got off the phone and asked my mum and dad what a return to work coordinator did, because this was pre-Google. So that's showing you my age. And I had no idea what it was, but that put me on this path of working with employers and insurers to manage workers' compensation claims. And obviously our business has evolved. We do everything from workplace safety, pre-employment medicals, OC rehab, outsourced return to work, and all of those things that go along with that. So today we're going to be talking about the risks associated with vicarious trauma. And yesterday when we were preparing for this meeting, I said to our presenter, John, I can give some examples. And I did just want to mention that today might trigger some of the attendees. We might talk about something that makes you feel uncomfortable. And what we encourage you to do is to reach out to your employer's employee assistance program if that does happen. And you can always reach out to us at Recovery Partners. So I had planned to give some examples about what we'd experienced at Recovery Partners and personally. My sister is a teacher and has been a teacher in the public education system for 30 years. And my sister-in-law is a principal at a regional Catholic school. And I would say out of all of the people that I know, teachers along with emergency service providers are really exposed to some events and matters that you wouldn't ordinarily think. And I don't think when people start their career as a teacher that they think that or consider the trauma that they might be exposed to. My sister had a child that was terminally ill in her class for 12 months before he tragically passed away. And the impact on her, the broader school community, obviously the family, it was very, very traumatic. And I think that what makes this topic very difficult, particularly for employers, is that a lot of these things, this vicarious trauma, is really outside of your control. We've got Nick from our safety team joining us today, who will probably chip in at the end and talk more about in terms of risk management and employer obligations. And it's quite, well, it's easier with those physical risks. If you've got a big machine, you can put guards on it, you can train people how to use it safely, or you can eliminate it by replacing the process with something else. But these vicarious trauma things are often outside of the employer's control in terms of eliminating from our workplace. So they're very, very, very difficult circumstances to deal with. We're actually dealing with something at the moment at Recovery Partners. We had one of our customers has tragically lost one of their young employees through a motor vehicle accident that happened late last night. And myself and our senior psychologist have been providing support to that employer from about 5 a.m. this morning. We have all the supports here, obviously, at Recovery Partners, but just seeing what's happening to that employer from the admin assistant to the director, it's, as you would imagine, having an enormous effect on those individuals and the business at large. So it's a difficult topic to talk about, but as employers and as insurers, we do need to discuss it, understand it, and see what we can do about preventing it, controlling it, and then minimising the risk when it does happen. So I welcome you all today. I'm going to hand over to my colleague, John, who is going to take you through the bulk of the session. If you missed it, we are recording it. We are transcribing it. You will be sent a copy of the presentation, and please feel free to raise your hand and ask a question or put a question in the chat. We do ask when you're not speaking that you do keep it on mute, just so it's more comfortable for all of the attendees that we've got on. And feel free to have your video on or off. It's a personal choice, completely up to you. So a very warm welcome from all of us at Recovery Partners, and please welcome my colleague, John.
Thanks, Kelly. Yeah, my name's John Zahara. So I'm a general manager at Recovery Partners. I cover our new employer service team and the ACT area. I look after a team of consultants who specialise in providing injury management support for psychological injury claims and job detached workers. Our team also provide other preventative wellbeing services and other psych services. My qualifications are in both psychology and work health and safety. I, like Kelly, have been working in the industry for a while, just over 20 years, and also the last 13 of those have been at Recovery Partners. And today's presentation will be, a basic overview will be just going through a bit of a definition, some basic concepts associated with hazard identification and risk management, the different financial, organisational and other implications psychosocial hazards can have on individuals and businesses, the importance of early intervention, and I'll provide some examples of some controls and some supplementary supports that our team can provide to assist organisations manage risks associated with psychosocial hazards generally, but in particular trauma. So this is our mission, to reduce the financial and human cost of illness and injury. So obviously what we strive, part of that is managing the risks associated with psychosocial hazards. So with vicarious trauma, just a brief definition, it's the emotional and psychological impact experienced by individuals who might be indirectly exposed by to the trauma of others, and that can potentially impact their well-being. Exposure to trauma is listed also as one of 14 psychosocial hazards in WHS legislation. We can also, today we're going to talk a little bit about workplace violence and aggression as well, as this can contribute to vicarious trauma. And we've got such a broad array of registered participants to this webinar. So I'll try and keep things fairly general because I know all of you work in different industries and all have differing roles. Some work in work health and safety teams or injury management teams, and others have differing backgrounds. And basically in terms of how vicarious trauma or workplace aggression or violence can impact employees, they can obviously start developing symptoms or develop diagnosed conditions. And their symptoms might include intrusive thoughts, nightmares and flashbacks. They might become irritable. There may be an increase in absenteeism and sick days. Some develop maladaptive coping mechanisms, such as resorting to alcohol use, can be hyper-aroused, have difficulty concentrating, trouble sleeping, and experience fatigue and so on. And sometimes we can pick up on these signs early on. Other times it can be a bit more difficult. People working in these types of professions. So example, Kelly touched on this a bit earlier, emergency services, counselling roles, helping professions generally are considered at higher risk. But it can actually happen to anyone. And we do see in some organisations it might be more prevalent in certain roles or certain site locations as opposed to all their employees generally. With regards to workplace aggression and violence, this can be in hospitality, retail, for example. And some of the customers we currently support that probably have higher levels of exposure to vicarious trauma or workplace violence and aggression include people that are employed to work as correctional officers or custodial officers in courts. In the correctional area, or it could be support workers or other allied health professionals who might support vulnerable clients. And I mentioned earlier, hospitality, transport, education and retail is an area where we do see a lot of exposure to aggression and violence. This is just a short video which will probably complement the information I've provided on definition. Hopefully this works. It worked in our trial run earlier. So it's only very short. So if it doesn't seem to work for you individually, I'm sure it'll work once we forward the slide pack at the conclusion of this presentation. Oops. Okay, I'll just moving on from that, I'm just going to go through some basic information about risk management. So when we talk about risk management, we look at primary or proactive prevention, which is more to do with early intervention, which is critical for preventing incidents becoming more severe or becoming diagnosable conditions. So these will be things like having a good incident reporting process available to employees, could be things related to their employee induction and training to make sure they can effectively perform the duties associated with their roles or are prepared for exposures that they might be exposed to in their role. It could include health monitoring or making sure that supervisors are actively checking in with their employees to monitor changes to their mental health and well-being, and just having policies and procedures in place. And then we also have tertiary or reactive interventions, which are also important, but they're relating to interventions that we may implement after an incident has occurred and a worker's been harmed by a hazard. So that would include things like accessing EAP, debriefing opportunities post-critical incidents, having support structures that promote a recovery at work and providing suitable duties or making reasonable adjustments to a worker's role after an incident has occurred that's impacted their well-being. There's some work health and safety relevance, and again, I know everyone's probably got differing levels of knowledge on WHS in general. So I won't spend too much time on this, but I mentioned previously that exposure to vicarious trauma or workplace violence and aggression are both considered psychosocial hazards. And so they pose a risk to the psychological health and safety of a worker. And the relevance to WHS is that we must make efforts to eliminate those risks where reasonably practicable, or at least minimise those risks in accordance to the hierarchy of controls. There's legislation that mandates that. There's a code of practice, which is quite a lengthy document, which provides some useful information, which I'll touch on some key points in the upcoming slides, international standards, and there's a lot of guidance material available through the different safe work bodies nationally. This particular diagram is called a HIRAC, hazard identification, risk assessment and control diagram, which it basically forms the basis of all risk management. As you can see, step one is identifying what psychosocial hazards are present in your organisation. Once you know what they are, you can assess the level of risk, implement controls, and then have an ongoing review process. So it's a continuous improvement approach to reviewing control measures for their effectiveness. And that might be after an incident occurs, or it might just be after a period of time. You just want to sit down and review your controls to make sure that they're achieving what they intend to achieve. The risk matrix is used to understand the consequence severity and the likelihood of occurrence. And it helps just prioritize actions, or helps with decision making about choosing the best controls and when to implement them. It might also help organisations get to a level where it might help them find an acceptable level of risk in some instances where elimination is not possible. But I'm mindful, I'm assuming a lot of people have come across these concepts, and if not, feel free to reach out. We'll have an opportunity to ask questions at the end of the presentation as well. And the hierarchy of control, which I mentioned earlier. So when addressing psychosocial hazards in the workplace, the hierarchy of control shows us that we need to prioritise elimination, then seek to, where that's not possible, seek to reduce risks through substitution, engineering, administrative controls, and as a last resort, use of PPE, with elimination being considered the most effective. I'm just going to provide some stats about mental health, like financial implications, organisational implications, and implications to individuals, which shows, it probably just highlights the importance of early intervention to prevent negative implications associated with incidents that result in more complex matters as a result of psychosocial hazards. So as you can see from this slide, the cost of mental health workers' compensation claims is approximately 5 times the average cost of physical injury claims. So obviously, a psych claim can be far more costly, and that's well documented across most workers' comp jurisdictions, or if not all workers' comp jurisdictions nationally. We know that psychological injury claims comprise of only about 12% of all claims, but about 38% of total scheme costs. They're increasing at a much faster rate compared to physical injury claims. So over the last 6 years, psychological injury claims in New South Wales have doubled compared to only a 16% increase in other workplace injury types. I know there's some similar statistics across other states as well, which are referenced in this slide. But basically the takeaway is that they are more costly, they take longer to get better, and have poorer outcomes. So return to work rates are significantly lower. And I think that information is pretty well documented. At the moment, it seems to be well known across all states. Some of the organisational implications, and we do see this a lot when we might have a customer reach out when things have gone wrong. But, you know, it might, so having an incident that becomes more significant as a result of a psychosocial hazard can impact productivity. Often the employee There may have been absenteeism or presenteeism linked to, for a long period of time. There's risks of work absence, can lead to medical separation, which is also costly and can have a negative impact on culture, productivity, and a small number of psychological injury claims or incidents can have a greater financial or organisational impact on overall performance than sometimes a larger number of physical claims. There can also be post-claim implications, such as premium implications for the employer, even if someone has been separated, or sometimes litigation. Just some well-being impacts. We don't want to forget about the employee themselves, but they, it can lead to exposure to trauma or violence and aggression can lead to them sustaining a diagnosable condition. It can subsequently not only impact them, but their family and any support network that they have as well. So our focus really is on early intervention. And just like Peter in the video, having a touch point or someone to reach out to was really critical in helping him in his journey. And so we're going to talk about some things that anyone can sort of do to help proactively manage psychosocial hazards, to not only protect their employees, but also mitigate those financial and organisational risks. So just going to go through some example control measures. Now, these are very general. It's very like with so many people here from a wide array of industries, it's very difficult to provide industry-specific examples for a broad array of industries. So these will be more general trauma-based controls that organisations can consider. But in saying that, each organisation really needs to do their own risk assessment and understand their own hazards, because they can vary. Even if you're, I noticed someone mentioned in the chat, security is another industry, for example. Within security, you have a number of different roles. So you might be a mobile patrol guard, or you might be someone who does venue work, or you could be a control room operator. They all have differing risks and exposures. And even the different customers that organisation might work for would create different risks in themselves. So it's important to customise any of these controls to the hazards and risks that apply most to your organisation and subgroups within that as well. So an example would be to rotate roles or activities to ensure adequate breaks from roles that might involve greater exposure to traumatic events. So an example of this might be having a shift work pattern might work well, because in some roles, exposure at night may not be as prevalent as exposure during the day. So allowing all workers to rotate between shifts that don't involve as much exposure would even that out, and not have one worker just having all the difficult shifts, so to speak. Implementing a file flagging process. This is something we do internally. So if we come across a client that our consultants are supporting and there's a known risk because that person has exhibited violent behaviour or aggressive behaviour in the past, we try and eliminate that by not meeting that person in person unless it's absolutely necessary. And if it is necessary, we do a risk management approach to that. So that might involve taking someone to accompany them to the meeting, or only meeting them in a secure location, like in our office, where there's appropriate support in place should something not work out. And we also have a flagging process on our online case management system that allows us to put a little red flag next to that person's name, which automatically tells anyone working on that case that there's a reason here that you need to be aware that there may be some changes to the way you manage this particular client's file. And at other times, we may if that person's behaviour is not in line with our policy and procedure of what would expect reasonable behaviour to be, we may exclude that person from our service delivery altogether. Critical incident response procedures. So this is just ensuring that as an organisation you have a process that's practical for workers to follow, which allows them to, there's a procedure in place that allows a response to critical incidents, including providing practical counselling support or other interventions or resources for that matter, and that employees know how to access that. It's important to ensure wellbeing monitoring systems are in place. So that might be equipping your managers with appropriate information and training so that they can respond and check in with workers on a regular basis, and aware of how to identify early signs of distress or injury or psychological injury and how to offer support. Or alternatively, depending on the level of risk, it may involve arranging external wellbeing checks, or if you have the capability internally to have set times that you may, every 6 months or 12 months, you may have a routine check-in to see how someone's travelling and pick up on those early signs. So just some additional examples. Ensuring employees know how to report incidents. We had an incident not long ago where an employee was subject to some inappropriate behaviour. We have a notification of injury process, and it was pleasing for me in that particular example that employee did report the issue. They didn't know they had to notify, but they called their leader. That person was able to do a notification of injury, which then triggered a risk assessment and allowed us to manage that situation. In that instance, the service was cancelled, but it's important that employees have awareness of what your organisation's specific process is in relation to things like that. Where repeated high risk exposures to distressing events is unavoidable, as part of the role, you may need to consider additional controls, and they might include things like reducing workloads to decrease exposure, maybe increasing breaks or recovery times. It might be implementing a mindfulness break in between tasks, having regular debriefs, or it could be periodic wellness checks, and so on, which I referenced earlier. Some additional controls which are probably more aggression or violence based as opposed to trauma, empowering workers to restrict, refuse or suspend service if other people fail to comply with the expected standard of behaviour that you would require where that's possible. Another example might be looking at ways to reduce customer frustration. Like, we don't condone inappropriate behaviour from customers, but if there's things we can do to keep them happy and they're less likely to exhibit those behaviours, and that's going to protect our workers. Communicating control measures to customers. So that might be displaying signs about, your zero tolerance to aggression, or maybe having security cameras present, etc. And then assessing individual client triggers. This is probably more to do with if you're employed in a support worker role and you're working with clients that might exhibit unpredictable behaviours. It's just understanding their behaviour plans and what might trigger different responses, and ensuring that the workplace has appropriately trained and skilled workers to manage those individuals accordingly. There's also a number of the controls I just mentioned are really specific to those psychosocial hazards that I referenced, exposure to trauma, workplace violence and aggression. But there's a number of control measures that apply more broadly to psychosocial hazards in general. And I'll just provide a list of some examples of these lower level controls. And what we often see is when we might have someone that we're supporting that actually has a mental health claim post-incident, and the reason that they've sustained the injury might be related to exposure to trauma or over a period of time. But often what we'll find is similar to physical claims as well. There's a number of other psychosocial factors that might have contributed to that person's overall presentation. And that might be, there was some job dissatisfaction. There might have been some issues with their supervisor, a number of other things that I guess indicate that we just need to look more broadly than just the hazard itself. So, for example, general controls that might apply more broadly is just ensuring you've got policies and procedures. So if workplace aggression is a specific hazard in your organisation, you want to have a clear policy in place that identifies that as a risk in your workplace and equips employees and leaders on how to go about managing that process if and when it occurs. The training for leaders, which I've sort of mentioned before about what their role is in the design and management of work and psychosocial hazards, and also in providing support to their workers if they experience distressing or traumatic events or get exposed to bullying or other psychosocial hazards, and building the capability of workers to manage high risk hazards. So that might be, for example, making sure that they have good conflict management skills if they're dealing with aggressive behaviour. If they've got to work in remote locations, then making sure that they've got the different emotional competencies and interpersonal skills to deal with those stresses. I mentioned this before, just providing clear guidelines and expectations about respectful behaviours and ensure that the leadership group models that behaviour in the workplace, ensuring professional support is available directly and indirectly for those that might be exposed to traumatic events or other psychosocial hazards. Providing clinical and managerial supervision to those who are exposed to work that has risk of occupational violence or traumatic events to manage the risk of burnout and PTSD, and just creating an environment where workers feel safe, raising concerns about psychosocial hazards. It's also important that there's mechanisms in place to manage any poor performance of workers or supervisors to complement those controls, and educating workers, particularly managers or leaders, about identifying the early signs of stress. And that could also be educating co-workers so they know how to respond if they identify that in their peers. Promoting a work-life balance is also important. So encouraging workers to implement self-care practices, take annual leave regularly so they can recover from periods of high demand, and promoting any supports you have in place, such as EAP, particularly for those that have greater exposures to psychosocial hazards, and accommodating reasonable adjustments for individuals that might need changes to their working conditions. And that might include employees that might have a disability or are recovering from an injury, or neurodiverse individuals. So I'm just going to talk a little bit about some supplementary interventions that we support some of our customers with that can help, I guess, expand or potentially become part of a risk control. So we do a lot of psychological pre-employment screens, and this is particularly for employers who employ individuals to work in roles where there's a lot of exposure to vicarious trauma or occupational violence and aggression. And what we do is it's a little bit different to traditional pre-employment testing, which might look at someone's aptitude or cognitive ability and the like. It's more looking at their level of resilience, their coping skills, and just asking them some behavioural-based questions to see how they would respond in scenarios that they might be exposed to in the role that they're applying for. And I think for me, that's really crucial for roles that involve exposure to vicarious trauma, because you need to be confident that the employees have the coping skills to manage the work, and that there's no pre-existing history that might mean they're not really ready to safely work in that role. And we do see, I know in the in the workers' comp claims that we assist, the mental health claims, you do sometimes see them being complicated by pre-existing mental health conditions. And sometimes we'll come across people and we'll identify and say, we don't really know why this person ended up in that role, but they clearly weren't able to do it before they've, they've exacerbated a pre-existing condition and so on. And it's ended up in a costly claim for the employer. So this can definitely help an employer understand what the risk rating is if they were to select that person for the role, and make a decision in addition to other interventions that they have in place as part of their recruitment process. And usually with our pre-employment screening, we will tailor it to a job task analysis or the position description that's been provided for the role. So it's specific to the risks and exposures associated with that individual role that the candidate's applying for. Some other supplementary interventions, we perform our wellbeing checks. So this includes for roles that might involve a lot of exposure to trauma, we can administer psychometric screening tools that can measure compassion fatigue, stress, or burnout. And it can give us a risk rating to say that this person might be at risk of developing a diagnosable condition because of the scores in that screening tool, coupled with a brief discussion with the employee. And this is a self-care wheel. So if we were to do a wellness check, we would usually provide some psychoeducation to the employee, explain what their scores are on the psychometric screening tool, and then work with them to encourage them to create a balanced self-care regime, whether that's implementing some healthy habits into their daily routines, which might be self-care related, things that might help them prevent burnout. It might be practicing stress management, setting boundaries, managing their workload, or how they can limit their exposure to triggers. We also can provide mental health literacy support. So that's more to do with training linked to workplace wellness and wellbeing. It can be included in organisations' wellness or wellbeing calendars. So that can be, preparing leaders to have conversations about mental health, how to observe changes in someone's behaviour or presentation, what signs to look out for, and the like. And it's also useful for employers to include a standard agenda item in their team meetings and so on, which can promote another form of reporting or early notification as well. I've just got, I'm just mindful of time, so I'll probably start getting ready for some questions, but I know we also have a work health and safety team here that can do a range of things. And my colleague, Nick, who's a team leader of our work health and safety team, is also present today and probably be able to answer some additional questions on some of this stuff. But in short, we can do a gap analysis and different audits, which can vary from compliance related gap analyses and assistance to ensure organisations have the right policies and procedures in place to more thorough audits, which might involve conducting psychosocial culture surveys, risk profiling, providing and making recommendations on any gaps that may need to be considered. I think that concludes my presentation for today. I'm happy to open up to any questions from anyone.
I'll just check the chat, JZ. While I'm checking the chat or people are coming off mute to ask questions, earlier on in the chat, Nick, someone noted that security staff are also highly exposed to vicarious trauma, and you've had first-hand experience of that. So obviously you would agree, what are some of the control measures that have been implemented in that industry?
Yeah, I can tell you, I've got 12 years experience in that industry myself. Yeah, it is a very exposed industry. We're quite often in that industry, you're the sort of pointy end of a negative situation anyway, which makes you the target for a lot of abuse, physical violence, and that sort of stuff. The control I found most effective with these is immediate debriefs post any kind of incident, and I do mean immediate, like as soon as everything's safe and can be, pull people aside, start talking about it straight away, with follow-up counselling and follow-up check-ins on people, just to get people talking, especially in that industry. It's still a very, should we say, male-dominated, macho-dominated. So talking about it there is seen as, it's a little bit weak, just deal with it, that's why we do this. But I can tell you from personal experience, not the truth. I've been involved in several fatality incidents in that industry.
It's terrible.
And talking afterwards is what helped the most.
Thank you, Nicholas. We've got Mallory with a raised hand. Do you want to come off mute, Mallory, and ask your question?
Yeah, sure. Can you hear me?
Yes, we can, loud and clear.
Hey, I work in Vic Workers Comp, and excuse me. We manage Victoria Police and a few other high risk cohorts, and I'm I've just moved out of a case manager role and into a different role in the business, but I'm frequently seeing exposure to things like IME reports, which list the incidents that injured the worker as a key kind of experience of case managers, and not a whole lot of management controls in place for looking after the case managers that are being exposed to things that have already injured others. So we've got lots of things in place for controlling our exposures to the workers in terms of those challenging conversations and things like that, but it's the material that I would like some tips on, or some things I can take back.
Look, and Mallory, thank you for sharing that, and I'm sure there's other people on the call that have that same experience. As John was saying, we actually do pre-employment screening for people that work in the justice system that are hearing and seeing in graphic nature, basically what you're reading in these reports. So what I would suggest, and Nick can offer some advice after if he feels there's other things to do, is I think that is something that is perfect for your safety committee. I would definitely take that to the safety committee and say, look, this is a particular risk, and what controls can we put in place? And certainly that would involve training for people, letting people know that can be the nature of the work before they start, assessing them to make sure that they're not predisposed to increased risk before they start the role, and then having assistance to be able to pick up the call, ring an expert, and to have that debrief amongst the team as both Nick and John have shared. That Mallory, that really is a tricky one, and there's lots of people that would be affecting so many people, and I think it's interesting I don't think people often consider, well, what's the impact of this on the case manager that's dealing not only with this one, but you've probably got a caseload of 30 or 40. So my advice would be safety committee and suggestions with having expert advice available, debrief sessions, and that pre-employment screening and training. Nick, Nick or John, would you offer can you offer anything else to assist Mallory in a very difficult circumstance?
Yeah, definitely. I think you hit a few key points there. Is selecting the right people for the role through, assessment, pre-employment assessment is the right thing. It's not for everybody. The other thing I could suggest is building resilience in small increments, similar as what they do, say, to deal with an allergy. You expose people to it little by little in a controlled way, till they build resilience for it. And unfortunately, it's not a nice thing to do, but that is, the reality. I can tell you as well, the National Health and Safety Institute and quite a few of the state regulators are looking into this right now, because in the context of, well, how do you stop investigators investigating traumatic incidents then being injured on a psychosocial level themselves?
Yeah, 100%. I've got a colleague who's actually been injured as a result of this kind of situation. So, and quite recently. So it's definitely at the forefront for me, and something that I feel like I can kind of take back to the business from this. So thank you very much for some ideas. When I saw the title of this, I jumped on immediately. So it was very yeah.
Thank you, Mallory. We wish you all the best, and let us know how things turn out. John, we've got a question in the chat from Jacinda. She says it was very helpful. No, sorry, wrong one. Alison, pre-existing mental health issues which may not be declared. How do organisations manage when a workers' comp claim gets complicated? Is the only solution a pre-employment screen?
Yeah, it's difficult if they don't disclose the information, because by law, an employee doesn't, or a candidate doesn't have to disclose that they have a pre-existing condition. I know with our pre-employment screening process, the questionnaire that the candidate pre-fills will ask things like if they're taking any prescribed medication, and sometimes I'll list an antidepressant or something, and that can prompt our assessor to probe further into what that was prescribed for, how long it was taken for, whether they're still, they administer some psychometric screening tools, which and I think that's why having a short clinical interview, in addition to psychometric screening tools for that type of assessment process, is really important, because you can get a more valid assessment. But yes, you're right. Like in some instances, especially if people are applying for jobs, they want to present themselves more favourably. It might be really difficult to get all that information. And I can see one of our consultants who does a lot of these assessments has got a hand up. So, Fatmi, did you want to add anything to that, or?
Yeah. As you were saying previously, I also wanted to add to what Melanie, I think it was asking about how to prevent the vicarious trauma from impacting. We also provide a service, or there's some services that we've provided in the past where it's a screener that we do every 3 months. It's a short screener. It's just checking to see if they've been impacted by the role and making sure that there isn't any further risk associated with the role. And if we do identify something, we can flag it, and then they can access EAP support or get a referral to a psychologist, or provided the resources that would manage that vicarious trauma from becoming something more serious. That's something that you could also use in the workplace to prevent the exposure from increasing and becoming more traumatic, I guess. Secondly, also with this, like a monthly or a weekly debrief with the team, other than the screener, is something where you can actually create that awareness and provide psychoeducation to your workers on, if you are experiencing these things, if you've seen something, reach out, and or you can even just debrief and talk about the situation and then provide, resources to those services. But these are some other things that you could also offer to prevent it from escalating, I guess.
Thank you, Tima and Jay-Z. John, file flagging is a great tip. How do we balance concerns for client privacy in identifying concerns for large teams in the disability support space?
I think the file flagging process we have, like it's basically, I don't know how it works in your industry specifically, but for us, if you are going to work on a particular client's file, then you're the only person that will normally have access. And sometimes we will have multiple people that have access, but it's because there's a reason that they need to have access to that client file. I assume it's probably similar in your industry. And so for us, we manage that by, if someone needs to action something on that file, that they would see the red flag when they immediately get access to the case online. And it would be something that's discussed in a handover, or if it was to be handed over to someone else, or if someone needed a supplementary service on the one case and a new person was given access, that would be discussed through that process. Hopefully that answers your question. Yeah.
And if you feel free, yeah, as I said, to put your hand up and ask for further information if required. Another question: can mental health first aiders be of benefit?
Yes, they can. I know internally we have, I guess we have our safety stars. We also have a mind hub. So we have, I don't know if we call them mental health first aiders, but it's someone that each site has access to someone who they can report any WHS incidents or concerns. We also include it as an agenda item in our team meeting. So every monthly team meeting we have, it's always one of the first agenda items is, has anyone got any WHS incidents or psychosocial hazards that they've come across that they need to report? So I think creating that culture where people have the opportunity to raise concerns is really important, especially because you might have employees who might not think much of something at a particular time and not realise that if they disclose that information, you might actually prevent something more serious occurring.
And I think it raises another question, and we've all seen this and experienced it. I think most leaders, most supervisors, most managers are comfortable in dealing with an employee when it's a physical injury. But as soon as there's a psychological injury, I find that it's not because they don't care, but they're a little bit nervous or they don't know what to say. And so those people that might be off work, or even when we notice changes in their behaviour, that internally people don't have the skill or the confidence to talk to people openly about it. So I think that's where the mental health first aid can help. But even just more broader education to managers and supervisors. I mean, Nick and I, between us, we've probably done, 500 sessions of, supervisors trainings in terms of what do you do when someone hurts themselves and manual handling and all those types of things. And they're confident with that. But if you see someone that's crying at work, or there's a change in their behaviour, or they've been exposed to something, I don't think that leaders in organisations are as equipped or confident in dealing with those. So the mental health first aiders can definitely help in there.
Yeah, and I think just expanding on that, I know it obviously depends on the level of risk to your organisation. So I know we've got some organisations, like we work with a large construction company that employs a lot of fly-in, fly-out workers that work very remote, isolated away from their family and so on. So they have first aid officers on site, mental health first aid officers on site. So it'll be a mental health clinician that, might be there once a week, so that, in addition to EAP, they've got access to in-person support. However, other roles might just say, look, we can just have access to an EAP support might suffice, but then definitely equipping your employees and leaders on what controls are in place at your organisation and knowing how to access them. I think that would be key.
And Jose, Allison's just asked in the chat if any of the organisations provide any special leave type for anyone who has witnessed something and requires time away for work.
It doesn't make sense.
And a couple of the attendees have said that they do, and there's other people interested about the parameters for this type of leave. So, and I can see that Tima has responded in the chat. At Recovery Partners, we have what's called a doona day, and that's a day that you can take off. You don't need to explain what it's for. It's just for you to have a day off. In terms of having parameters around it, I suppose it gets a little bit tricky, because if someone's seen something at work, then that, and there's incapacity for that, then technically that should be a workers' comp claim. But we don't want, obviously, to encourage people to be lodging claims unless it's essential, and which is obviously their legal right. If it's something that's happened outside of work, like, and as we said, you know, you can just have a doona day for whatever reason. The question, does it come from personal leave? Yes, it does come from, it's deducted from personal leave, but some organisations have, it comes out of other types of leaves. So yeah, we can share our policy for sure. Now, someone else had their hand up, but I think that they have gone. All right. Well,
Stuart has his hand up.
Oh, Stuart, so I'm so sorry, Stuart. I can't see you. Oh, there you are. Okay. Final question from Stuart.
It's not so much of a question, it's providing a little bit of context for you in relation to your previous question in relation to leave directly related to work-related exposure. By way of introduction, I'm the Executive Manager of Safety Branch for the WA Police Force over here in WA. And one of the things that we have available to our officers and our staff, it's most often accessed by our officers, is extreme incident respite leave.
Oh, that's fabulous.
Now, this is as much as anything, this is a preventative early intervention where officers who are involved in a critical incident receive, and I can't go into the specifics, unfortunately, of what falls within that, but if they meet that criteria, and we are very flexible with how we actually apply that criteria, they are mandated to take 72 hours leave away from the workplace, and that will also include being interviewed by critical incident investigators, including our internal affairs, where they cannot be interviewed during that time. It's recognised on the advice, it's been worked up over the course of several years with our injury coordination and support service team and our psychology unit, that it's a very important intervention to allow time for decompression, so that task loadings are removed and they can receive time away from the workplace where support can be provided directly to assist them through what is inherently generally a very traumatic incident. To give you an idea from a practical point of view, unfortunately, 2 weeks ago, this is in the public domain, our officers shot an individual who attempted to stab multiple officers. We had 16 officers allocated EIR in response to that incident, and were away from the workplace for 72 hours, and we managed that with our resourcing accordingly. But it is a non-negotiable 72 hours away from the workplace.
Well, Stuart, sorry, continue.
No. So I just thought that might be beneficial in relation to industry comparison, particularly from a law enforcement and emergency services perspective.
Well, and thank you so much for sharing your experience and that an initiative by WA Police. I think you can see in the chat that certainly people are thinking that's a wonderful initiative that you have, and it is such a difficult role, particularly. Sorry, there's another. Do they receive support? Oh, so Stuart, just if you don't mind, just people are asking, in that 72 hours, I'm assuming the answer is yes. Can they access support?
Absolutely.
So they can access.
Absolutely.
And if they want to debrief with their colleagues, they can. You go have a meal.
Absolutely.
Oh, that's fabulous.
The only thing that they are not permitted to do is return to operational duty for 72 hours. They are
That's
free
incredible.
to interact with their colleagues, with their normal social circles. Our injury coordination support services team, which is staffed by trained police officers, as well as our psychology team, will provide extensive support to all of the officers during that 72-hour period and beyond. But with a very strong focus on intervening at the earliest possible opportunity and providing the immediate support to smooth out some of the rough edges that will inevitably arise after that incident. But they're also kept a very good eye on, and there are set check-in periods after, at like 2 weeks, 4 weeks, 6 weeks, 8 weeks, to make sure that they are progressing well and none of the delayed symptoms and outward sort of expressions of the incident are starting to crop up.
Well, I mean, and again, thank you for sharing that, Stuart. That's certainly one of the most advanced and generous programs that I've heard of, and it's fitting for the dangerous work that you do for keeping us all safe. So thank you again. Look, we've run a few minutes over, but I'm sure that everyone was very keen to hear Stuart's comments and for the conversation to continue. Obviously, this is a topic that is important and becoming increasingly concerning for employers and insurers. So we will continue to add webinars like this and provide education to our audience and our partners and our customers. So from here, you will get a copy of the recording. We'll send some additional resources. And again, thank you so much for joining us. If it's triggered anything for you, please contact EAP or us, and we look forward to seeing you all soon. Thank you.